I'm sure most of us have complained at some point that we are, quote, burned out at work, but now it is an official diagnosis. The World Health Organization recently made burnout an official entry in its International Classification of Diseases handbook, which helps medical providers diagnose diseases and conditions. It's not a medical condition officially, but instead an occupational phenomenon, according to the WHO, and that changes the game, not just for patients, but for medical providers, our next guest says. Jaime Vinck is the CEO of Sierra Tucson, the addiction treatment center near Mount Lemmon.
Burnout is characterized by three major things: feeling of energy depletion or exhaustion, increased mental distance from one's job, which manifests in cynicism, being extremely negative about your work, failing to see the value in what you do, and reduced professional efficacy, which is we are losing our purpose, we're losing our way, and becoming detached from the mission of what is our chosen field.
Right. And the WHO sort of says, doctors, before you make a call on this, make sure that you can rule out some other sort of similar diagnoses, right? What would those look like?
So that would be anxiety, depression, mental health disorders that are actually in our diagnostic manual. And this is one step prior as a syndrome.
So are you seeing this kind of thing among patients? Like, is this something that surprises you at all that it got this kind of recognition from the WHO?
No, it doesn't surprise me at all. In fact, I'm delighted by it. I have spent the last 12 to 18 months talking about compassion fatigue, which is something similar. It's the combination of a secondary trauma as well as burnout. And burnout is something that is attributed to organizations. Too many demands on too few resources. And it's the feeling when someone is overwhelmed by their responsibility and feels detached from the reason. They've lost their why. And that's something that we see in society more now. And I believe it has a lot to do with access, that we don't get to power down. We don't get to step away from our professional role because there is this illusion that we're always on, that we're always available.
So CNN reports that researchers have looked at burnout for a long time, but it's always been sort of a murky definition of what that is. So what kind of cultural factors do you think have led to this? And do you think it's more common now than it may have been in the past?
I do believe that it's more common now than it has been in the past. And I believe that the culture of social media, the culture of electronic devices has created this need to always be available and accessible, and that we can't necessarily obtain that work-life balance because we can't power down. We can't step out of it.
So what are the kinds of things that you can do as a clinician to help? Like, how do you treat this?
So the first thing that we do is to really teach people how to self-regulate, how to get in touch with their body so that they know when their heart starts pounding, when they start to feel the physical manifestations beginning, that they get to step out to do things even as simple as breathe, to step away from your computer screen, flip your phone over, meditate, spiritually connect, those kinds of things. Because oftentimes, once something hits our body, then it's too late.
What does it mean to you to have this be sort of something that's officially recognized in this way? Like, does it make it easier for doctors, for clinicians?
Absolutely. And it also makes it easier for us as leaders. I run an organization where we have 450 employees. And I really love that the World Health Organization has stepped up to the plate, if you will, and made it an official syndrome. Because now, as we talk about it, it's not so much as, oh, that's just clinicians being clinicians, with their psychobabble kind of things. We can tie it to actual workplace productivity because I mentioned earlier, burnout is about the organization. It's about what's going on. And it's incumbent upon us as leaders to look at How are we assigning workload? What are our demands? Are we the ones that are texting our employees at 10 o'clock at night expecting a response?
So you're saying as a leader of a large organization, like this is an opportunity to spread the gospel, basically, to say, let your employees have a work-life balance.
Absolutely, and to own it ourselves, because that's one of the things we can do organizationally is to, number one, share the fact that we've all been there, we've all been burnt out, and model the correct behavior. Because if I'm not stepping away as a leader, then the employees will not model healthy behavior. The other thing that I think is important to note is that right now in society, we are in the midst of a suicide epidemic, an opioid epidemic, and it's very important that work be a place of belongingness, a place where we can feel good about ourselves, good about the choices that we've made, not a place to go and become even more stressed out and question our why.
All right. That's Jaime Vinck, CEO of Sierra Tucson. Jaime, thank you so much for coming in.
Thank you.